Hello, I'm Helen Bingham. I lead the Resource Discovery workstream in Knowledge for Healthcare. This short session focuses on what Knowledge for Healthcare proposes in relation to digital knowledge resources discovery and delivery. Here's a reminder of the ambition of Knowledge for Healthcare, paraphrased as the right knowledge and evidence used at the right time and in the right place to make a positive impact on healthcare. So what needs to be done around digital resources and systems to deliver this ambition? As with the first iteration of Knowledge for Healthcare, we use driver diagrams to shape and to describe the strategy. Here's the high-level Knowledge for Healthcare driver diagram. The ambition, right knowledge and evidence, right time, right place, is on the left. On the right are the 5 high-level strategic outcomes that together will drive delivery of the ambition. The highlighted one, that staff and learners make optimal use of high-quality knowledge and evidence resources at the point of need, is the focus of the resource discovery workstream. We paraphrase it as quick and easy access to digital knowledge resources. This slide is the driver diagram for resource discovery. It identifies the 4 specific outcomes we believe we need to deliver the strategic outcome of quick and easy access to knowledge and evidence resources. Listed there in the middle, we have more central and coordinated content procurement, more cohesive and streamlined systems and processes, more joined up partnership working, so HE working with other arm's length bodies, HE working with library teams working together. And finally, maximising use of resources and demonstrating value for money. In turn, there's a bunch of interventions to drive those outcomes. They're in the right-hand column. There's more detail in the strategy document. For the rest of this presentation, I'd just like to highlight the key current priorities. Number 1 is extending central and collaborative procurement. Library staff repeatedly tell us that it would be good if more resources were purchased nationally. We know that more central procurement would make access to knowledge resources less of a postcode lottery for healthcare staff. It would get us better prices. It would free up at least some of the time currently spent on local e-resource procurement and management. Currently, 75% of NHS investment in digital knowledge resources take place at local trust level. We believe it should be the other way round. 75% of investment taking place at national level, 25% at local level to meet particular local needs. Turning this around is not going to be easy. Most HE funding flows from the centre to local organisations. But we'll renew our effort to make the case both for more national investment and for pooling of local funding where this makes sense. We'll also renew our efforts to influence other arm's length bodies to collaborate with HE on investment in e-resources, and our efforts with publishers to ensure their pricing is fair and transparent, based on likely actual users and a realistic assessment of value. The second key priority area is streamlining the infrastructure. With the current national infrastructure only covering bibliographic databases and journals, it wasn't meeting sufficient of the need of sufficient of the workforce. End-user discovery research highlighted the many frustrations faced by NHS staff and learners trying to access the knowledge resources they need for their roles. We've been seeing a year-on-year decrease in searches and in full text downloads, and a year-on-year increase in libraries investing in local discovery services to supplement the national infrastructure. So we've been able to make the case for a national discovery service, and this slide sets out the vision for the service. The critical bit here, the USP, is the connection to local library support. The key products we're using as the basis of the service will be EBSCO Discovery and Full Text Finder and LibKey from Third Iron. The National Discovery Service is only part of the picture, and there are other elements of the infrastructure which need to slot together and join up to support smooth user journeys and efficient library workflows. Library management systems, or LMS, are obviously critical to the day-to-day operation of library services. There are shared LMS in some parts of the country, but many instances of single service LMS, and over 90 instances of LMS in total. Our plan is to transition to HE-funded regional LMS across the country. Core design criteria and guiding principles for knowledge of healthcare include economy of scale, opportunity for standardisation, best use of specialist skills, effectiveness and efficiency, and we believe that regionally shared LMS tick all those boxes. Our vision is that the regional LMS will integrate with the national discovery layer, so that Discovery Service users can find locally held content and borrow and renew books, and in order to help streamline interlibrary lending and document supply processes. So the National Discovery Service will make it easy for users to request items not available in full text, with pre-populated requests delivered to the relevant local library service. But we envisage two further developments: library staff being able to manage these requests within their LMS without the need for copying and pasting, and also library staff having a view of the national link resolver holdings, which works as a national holdings list for sourcing interlibrary loans. A third strategic priority is meeting the needs of expert searchers. The National Discovery Service is being designed to meet the needs of the majority of the workforce, but we must clearly also support the needs of advanced and expert searchers, including library knowledge specialists. The Healthcare Database Advanced Search, HDAS, used by many librarians, has had to be decommissioned. So there's now work to be done at pace to ensure the database provider interfaces are optimally configured for NHS use, to provide librarians with access to reference management software, and to ensure that healthcare librarians across the country have the skills, confidence and support they need to continue to develop and hone their search skills and expertise. We also need to make judicious use of new and emerging technologies, whether to support novice searchers or expert searchers, or to improve back office processes. Open access. This is the final priority area I'm going to cover on my final slide. Like everyone else in the NHS, HE is committed to the principle that research outputs funded by the NHS should be freely and immediately available to all. The removal of paywalls and the transition from paying to access to paying to publish will have far-reaching impact on all of our work. So with lots of organisations and librarians already working in this area, what should HE's role be? This slide indicates the areas we think we should focus on. They include education awareness, so doing centrally what we can to help local library staff educate, inform and influence individuals and organisations. Negotiating with publishers, working with JISC for instance to explore the extent to which transformative agreements, also known as read and publish agreements, in higher education might be extended to the NHS. Optimising open access resources and repository content within the National Discovery Service, and coordinating strategic collaboration. Most NHS organisations think open access is a good idea, but the NHS in England doesn't yet have a joined up policy and strategy, isn't presenting a united front to publishers, so there's much to be done. That concludes my presentation. Thank you very much for listening, and thank you for all the support, suggestions and feedback that you and your colleagues have provided along the way so far. Your input will continue to be invaluable, so please keep the questions and suggestions coming.